afternoon. Yes. Wow, it's been a long time. We spoke about health and wellness because we say health is a wealth. And of course, a worker who is healthy will be productive, will be able to do the work very well, and of course, will become profitable both for himself and the employer. So today we'll be looking at a very important aspect of health and wellness. That is, we're looking at oral hygiene. And some persons have also asked me, of course, I'm going to take this as a series. Today we'll just lay the foundation for what actually is oral health and hygiene. And at the same time, maybe what will be next time again, we'll now be looking at in the workplace, what are the implications, if somebody will call in and call into the office and say, oh, I have toothache, what is the implication to the company's bottom line? So for today, let's look at oral health and hygiene. And I must emphasize that when you have any tooth pain, tooth decay, please go and see a dental nurse or a dentist. Go to the hospital. I'm sure they have facilities that they will look at it very well and they will treat you appropriately. You might just say, after all, it's not just my teeth. We've seen the adverse effects of tooth decay that is not treated very well. For generally, your oral health, oral hygiene is very, very important, So let's see, oral hygiene and health. So we'll be looking at what is good oral hygiene. What are the tips? Then when do you see a dentist? Then we'll look at some other issues as we go along. So ensuring healthy teeth through good oral hygiene yields overall health benefits. Dental problems such as tooth decay and gum disease not only lead to tooth loss, but are associated with serious chronic conditions such as a heart disease, stroke, arthritis, and of course, diabetes. So what we have just said now, that dental problem, tooth decay, gum disease, it's not just your tooth will just, you lose your tooth. They have been known to be associated with serious illness, chronic conditions, heart disease, stroke, arthritis, and of course, diabetics. So along with proper tooth brushing, I've always mentioned tooth brushing twice a day and daily flossing, maintaining a healthy smile can also mean making dietary adjustment, limiting alcohol and tobacco use, and ensuring you are keeping up with regular dental appointments. Most of us don't even go for dental appointment. Most of us don't even brush twice a day. But we are saying you brush twice a day and also do what they call daily flossing. That is, you floss, once a day. What is that flossing? According to dentists or dental technology, yes, it's kind of something that they use to remove some of the bacteria and dirt in between your teeth, and the gum where your brush cannot get to. So again, this is more reason why you should be aware of this, so that when you visit your dentist or your dental nurse, you'll be able to explain this better and you understand it very well. So let's look at an overview of what you should keep in mind to protect your teeth. So what is good oral hygiene? Good oral hygiene, simply put, is a set of practices and habits that promote and protect your teeth and gums. But how can we tell that our teeth is healthy or our gum is healthy? What defines good oral health? Well, good oral hygiene is the ability to speak, chew, and make facial expressions without pain, discomfort, or loss of confidence is therefore an essential aspect of mental and physical health. Some persons cannot smile. Some person cannot chew. Some person cannot speak openly, you know. So, and that's why I'm saying good oral health. Good oral health, the ability to speak, chew, and make facial expressions without pain, discomfort, loss of confidence. So if you don't have good oral hygiene, you can't speak in the public. Your confidence will be down. So we can see how important it is in the workplace where you do a lot of presentation. Like those of us in the financial service industry, a lot of presentation. Some of us even in the media, you do a lot of presentation. So you need to have good oral hygiene. Fundamentally, the aim of a good oral hygiene routine is to prevent the buildup of plaque and tartar on the teeth, those things that can discolor your teeth. Related and equally important is working to stop the progression or deter gum disease and what dentists will call gingivitis or periodontitis, a severe form that arises in the absence of treatment. You know, when you don't take care of your gums very well, you know, you have this gum disease that dentists call gingivitis. Then if you don't treat it at all, the severe form, you know, it becomes periodontitis. So all these are just dental language. Most important thing there is take care of your teeth and your gums properly. How poor oral hygiene can affect you? How can poor oral hygiene impact your health? Let's look at some of these. Cavities, gum disease, and other issues can lead to tooth loss, which can impact your bite and ability to chew and eat. Untreated gum disease is associated with chronic health conditions, including heart disease, stroke, and of course, diabetics. Poor dental health appearance of the teeth can significantly impact your mental health, raising self-consciousness and lowering of your self-esteem. Of course, we've seen that in public. People who don't have a very good white teeth, as the case may be, your self-esteem is lower. You can't talk openly in the public. You can't do presentation. So all this will affect you mentally. Not getting timely dental care and cleanings reduces the chances of diagnosing and treating oral cancer. Yes, oral cancer, that is also a very big problem. You know, some people can say it's a cancer of buccal cavity, cancer of the buccal cavity. So please, like I said, take care of your teeth regularly. Brush twice a day. You can floss, you know, maybe once a day. And of course, try and see how you can visit your dental nurse or the dental technologies, then of course the dentist. In fact, your mouth has a lot to say about your oral health. How do you practice good oral health, good oral hygiene? Ultimately, good oral hygiene is more of a journey than a destination. Not only does it require adopting and adhering to positive habits, it means being ready to learn ways to get even better at caring for your teeth and gums. Here are some points we can, you know, practice or keep in mind. Somebody is asking me a question. Thank you for that question. The person is saying, realistically, how often should you change your toothbrush? Well, I would say maybe every 3 months, as the case may be. That's interesting. Okay, brush thoroughly twice a day. It is common knowledge that regular and thorough toothbrushing twice a day is cornerstone for dental hygiene. Every morning and every night. Spend about 2 minutes brushing your teeth with 30 seconds of each side. Lower front, lower back, upper front, and of course, upper back. You know? Yeah. You see, oral health tips, what adults can do to maintain a good oral health. You know, so there are things you can do. We have just mentioned brush twice a day, in the morning and of course in the evening. So keep in mind that you should replace toothbrushes regularly, every 3 to 4 months, or if the head is worn out and please replace your brush every 3 to 4 months. In fact, 3 months. You can use dental products that contain, well, fluoride. The mineral fluoride can also help strengthen teeth. Choose toothpaste that contains fluoride, such as those approved by the Nigerian Medical and Dental Association. I will not mention any brand here. If they want me to mention, of course, they can come for adverts. There are so many of them there. They can come for adverts and we'll promote them. Of course, we'll look at their content and see that, yes, they meet the requirement. But most importantly, always, when you have any tooth problem, try and see a dentist. So another thing we can do again is don't neglect flossing. Along with brushing, flossing between the teeth daily is critical to protecting dental health. In addition to standard floss, other means can make this even easier, including using pre-threaded flossers or water flossing device. You know, again, see your dental technologist for you to do it properly. So by removing food trapped between the teeth along the gum line, flossing gets at food particles that brush isn't able to access. You know, when you brush, the brush might not get to certain parts of the gum. So with flossing, you should be able to get that out. Practice brushing technique. Regular brushing is important, but it's also crucial to employ the correct technique, you know, according to the Medical and Dental Association of Nigeria. Here is what you should keep in mind. The right size. Make sure the toothbrush you use is appropriately sized, allowing you to access every dental surface in your mouth. Appropriate angle. Generally keep your brush at a 45-degree angle, you know, to the gum. Something like this. Okay, get all the sides. Make sure you are brushing the outer, inner, you know, and chewing surfaces of your teeth. Short stroke. Employ gentle brief stroke, moving back and forth as you brush. Brush inner surfaces of front teeth with vertical up and down strokes. Like this, like this, like this, like this. I've used a brush to demonstrate, but maybe when we meet the next time, we'll look at it. Then tongue care. Since the tongue can also be a repository for plague-causing bacteria, make sure you brush it as well. People just think when they go and brush, they don't take care of their tongue, but it's very, very important you take care of your tongue. Eat a healthy, well-balanced diet. What you eat and drink can also impact your dental health. Generally, it is a good idea to stick to a healthy, well-balanced diet. This means emphasizing the following: fiber-rich food such as beans, apples, grain. You know, you can take this one. Then dairy products such as yogurt and milk. Green, you can even take black tea, which contains polyphenol that can combat bacterial formation in the mouth. Chewing sugarless gum, which can produce saliva in the mouth, protecting teeth. Water and foods with fluorine. Drink plenty of water most of the time. In addition, some foods and drink need to be avoided, including sticky candies, hard candies, starchy foods such as soft bread, some pastries, soft drinks and soda, especially those with sugar, as well as phosphoric and citric acids. Avoiding dry mouth. An unintended side effect of some medication is dry mouth, which can impact dental health. Talk to your dentist about your options if you know or suspect the drugs you are taking are leading to this condition. It's very, very important, dry mouth. Limit alcohol and tobacco products. Among the many negative health effects of drinking alcohol are significant impact on dental health. Alcohol is noted risk factor for oral cancer, and consumption has been associated with developing periodontitis. In addition, smoking is closely associated with gum disease. This habit weakens the immune system, making it easier for gingivitis and periodontitis to develop. So that's why, in fact, when you see a smoker, nobody will tell you. You recognize them by even their lips. Use mouthwash. Another strategy can help maintain good dental hygiene is to use mouthwash. Not all products are the same. Some cosmetic mouthwashes don't really go after the bacteria that cause this bad breath, but use a mouthwash that has been recommended to you by your dentist. Generally, you are best served using therapeutic mouthwashes. Look for the following: active ingredient over the counter and prescription mouthwash. Well, I will not mention their names, but fluoride is always important for you to use. Of course, peroxide, essential oils, and all that. As with toothpastes, it is a good idea to choose a mouthwash that is approved by the Medical and Dental Association of Nigeria. Visit your dentist regularly. Regular dental visit prevents a lot of plaque and tartar build-up and ensure that there are no signs of other dental issues or cancer. As with many aspects of health, the sooner problems are caught and the more proactive treatment is, the better off the outcomes. How often you should visit the dentist depends on your specific case. But if you have no problem, schedule at least one appointment a year for cleaning and evaluation. You don't need to wait till you have a pain in your mouth or you have toothache and all that. Once a year, visit your dentist. However, if you have a gum disease, cavities, or other oral health issue, you may require additional work. So let's recap what we have looked at today. The best strategy for protecting your dental health include brushing properly twice a day, daily flossing, limiting or stopping alcohol or tobacco use, avoiding sugary foods and soda, and getting regular dental care. When to see the doctor or when to see the dentist. Another important aspect of good oral health is knowing when it is time to see a doctor, as noted above. As we have said earlier, the sooner you get help, the better off you will be. Sign it's time to make an appointment or seek emergency care. When do you think it is appropriate for you to see the dentist? When there is a tooth pain or loss, bleeding gums, difficulty chewing or swallowing, constant or consistent dry mouth, jaw pain, especially when opening or closing the mouth, spots and sores on the tongue, gums, or inside of the mouth, feeling of self-conscious about your feet. Some conditions and treatments can contribute to dental problems. Make an appointment with your dentist if you are experiencing or undergoing any of the following: chronic health issues like heart disease, diabetes, or even HIV, chemotherapy or radiation therapy, pregnancy. Let's look at that again. Some conditions and treatment can contribute to dental problem. When you are pregnant, make sure you have an appointment with your dentist. If you're experiencing or undergoing any of the following, if you a chronic health disease, you have it, please also, after seeing your regular physician, you can also see your dentist. In fact, when you're even pregnant too, also see your dentist, or when you're going through chemotherapy or radiation therapy. So ensuring good oral health is important, not only to help with self-esteem, but for overall wellness and health. Dental problems like tooth decay and gum disease can cause chewing problems and discomfort. Good dental hygiene practices include brushing properly twice a day, flossing once a day, staying clear of tobacco, alcohol, and sugar foods and drinks, and getting regular care from your dentist. It can be easy to overlook dental care. Yes, it can be easy to overlook dental care most of the time. The health of your teeth takes a backseat to other issues, but it's never a good idea to put off oral care. Beyond ensuring a healthy, bright smile, keeping up with good oral health yields numerous benefits and should be considered part of an overall health and wellness program. And that's why you can see that today I've taken time to look at this oral health and hygiene in the workplace. It is very, very critical. Imagine if you are in a meeting and a colleague is talking, and of course you cannot help it. You can perceive the bad breath that is coming from that colleague. Of course. In fact, it has been noted that some persons cannot even keep it to themselves. They will just begin to say certain things. In fact, I've been in a company where at one point in time, people complain of a particular manager of his bad breath, and the MD of the firm had to go and talk to him. So please, when people are coming for meetings, they should brush their mouth properly. And of course, organizations can also make it the facilities available where employees can, brush their mouth when they are in the office before they go for any meeting. Just 2 minutes, you will do it, and that is very, very good, because we have seen that oral health and hygiene impact on your bottom line. So critical in all of this is that you are mindful of how your teeth and mouths are feeling. If something seems hairy, don't hesitate to reach out to your dentist. The sooner you get the care you need, the better off you will be. Thank you. When I come your way next time, we'll be looking at the impact of oral health and hygiene on the bottom line of a company, the profitability and productivity of the workers. Thank you.